what do? You're about to go on for like major surgery in your spine. It's like seriously scary. Hi everyone, it's Mama Bear here. Today I'm doing a video about my bad back and the chronic pain that I've suffered for a few years now. So if you're interested, keep listening. I've always had some type of a sore back, but I didn't really realize as a child or a teenager. I don't remember what it felt like then. And my parents used to take me to a chiropractor and, get clicked back in. And I remember it feeling better once I did that. But it was really when I got pregnant with my first pregnancy with Maya that things really started to just become severe. Sorry, I've got some notes in front of me because so much happened and I was on so much medication and I was in so much pain that I've seriously forgotten about half of what actually happened. So I had to write some notes. So I'm just referring. I had Maya, the birth was fine. I had a water birth. And probably about 3 months into it, I got postnatal depression. I think I got postnatal depression because I really, really had a hard time breastfeeding. I really struggled with it, and it wasn't until I actually saw a lactation consultant that I actually got some good advice and I was able to become more successful at it. I think my postnatal depression calmed down once I kind of sorted that out. One thing I noticed is that I stopped exercising because everyone knows who's had postnatal depression, you don't feel like doing anything. Physically, just putting clothes on for the day was hard work. It was like just thinking about trying to just have a shower or making breakfast was like the hardest thing. So I stopped exercising, and I think because of that, that's why my back started to get really bad really quickly. Maya weaned at 7 months, and because of that, I stopped getting the relaxin hormone in my muscles. So I think everything started to tense up in my back. It really did. And I wasn't exercising, which I now know is the key for my body, is to walk. Just walk. That's the main thing that I need to do, is walk. So things started getting really bad in September, October 2013. I was actually hospitalized because of the horrific pain I was in. It was really difficult. And then this GP that I saw said that I needed to be on complete bed rest. So I came home and he meant like complete bed rest. Unless I was going to the toilet, I needed to be laying down. So I did that. And it got worse. Because I now know it was because I wasn't walking. I wasn't exercising. So because I did that, what happens when you lay down for weeks at a time? You get muscular dystrophy. So my legs were like this. All my muscle wasted away, and I swear that happened in like four days. My muscles became so weak. I had a 7-month-old baby who, although I wasn't feeding her anymore, I had to have someone over caring for me 24/7. So while Daniel was at work, his mum or his sister, my mum, a magnitude of people would come over and care for me during the day because I had this 7-month-old that needed looking after. I remember that they used to sit up her high chair next to my bed so I could, from the distance, like try to feed her or just watch her and be involved. And it was so hard because I was on this medication and I'm laying in bed in agony, and I can hear them playing just outside my door, like in the next room. And it was heartbreaking that I couldn't be there to care for her. During naps and things, they would come and put her next to me and we would co-sleep because that was really the only time I got a chance to be close with her, because I couldn't have her crawling all over me or the bed because just the slightest movement was agony. So I started getting normal depression on top of this postnatal depression. I just was in a really bad headspace, to be honest. Because of that, I got addicted to pain medication. I was taking Argin, Endone, they're the main ones, and I started getting addicted to them. I started using a TENS machine, which did help, but I felt like I had to have it on 24/7. So in November, I started getting a little bit better. So I'd been on bed rest for a while. I was having, help from physio, the hospital coming to my house and doing all these things and helping me with exercises just to get out of bed. I then use a wheelchair. I was in a wheelchair. I was in so much pain. I started getting all this numbness down the back of it was my left leg, and it was really embarrassing. Sitting was excruciating. Laying down was excruciating. Everything was excruciating. I managed to be able to sit in a wheelchair for, maybe 10 minutes at a time, and then I'd have to go back to bed. So this went on and on for weeks. And then I got to a point where I could walk and stand for 5 minutes, and then I would have to sit in the wheelchair. Or I actually then graduated to a walker. I was 27 and in a walker. It was just horrible. And my baby had started walking while I was in a walker. I couldn't drive. I didn't drive for a long time. I drive a manual, and just putting my feet on the pedals and moving my back was just shocking. It was shocking. January 2014, I actually was able to get off the pain medication. I weaned myself. It took a while, a long time, because I was addicted to this stuff. So it took a while to get off it because I wanted it. As soon as I got up in the morning, the first thing I wanted was some more medication. Even though I knew that I wasn't in pain, I just wanted it. I guess that's just the addiction part of it. By this stage, I had a really, 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 really numb leg. The whole back of my left leg was numb. And, I'd been, MRI scans, specialists, doctors, all sorts. And they pretty much said you can't do jack unless you have health insurance, which I didn't. So I just had to get put on the list for public hospital. And I was waiting. In this time, we actually did go and get health insurance. Sorry, the kids are outside. But we had to wait, the waiting time. I think we had to wait a year. Anyway, so we just continued along. So what happened was I had the numbness. It was under my foot as well, all the way up my leg. And I'd have shocking sciatica all the way down at the same time. What started happening was TMI, for anyone out there that doesn't like gross things, but I couldn't feel myself doing a poo. I couldn't feel my bum anymore because I had numbness going up into my glute, but I couldn't feel my sphincter. And I was so constipated from the medication. At this point, I wasn't vegan. I was still consuming animal products. Oh my God, I would be eating 6 prunes at a time, a few times a day. That's a hell of a lot of prunes. If I eat 1 or 2 now, it's going right through. Keep the sand outside. So I finally got on the waiting list, the public waiting list, and I think they said 90 days. So I'd been suffering this since September. So it had been months and months and months of horrible pain. I got put on is it a register? I don't know what it's called. So I had about 90 days before I could go into the public system and get the operation. My L4, L5 disc. I didn't actually explain what it was. I'll put a picture up. You've got your L4 and your L5 vertebra, and then in between you have a spongy disc. Now inside that disc is fluid, and what had happened was, for some reason, the vertebrae rubbed too much or pressed, and a whole heap of fluid from the disc went pfft. But what the closest thing to it is your spinal cord. So the fluid actually went out into my spinal cord, which is called people call it a bulging disc, and it hardens it or calcifies straight away. It presses against your spinal cord. This is why I had the numb leg, is because, and you'll see in the photo, all the fluid, the calcified fluid that had come out was pressing against my spinal cord, which, if you've got a straw that you drink out of and you bend it, you can't drink out of it anymore. So any signals, that were meant to be going there up to my brain, they weren't going anymore. So it was numb because no signals were getting through from my brain. At this point, I really got to my lowest of lowest depression. I was really, really depressed. I was taking it out on Daniel. I was in a bad place. I then went to the hospital again. So at this point, I'm able to walk around and I'd started driving. I was off the pain medication, but something happened. I can't even remember now. And I had to go to hospital again by ambulance. I just felt like I lost a chunk of my dignity. I had so many doctors come in who had students. At this particular time, I had about maybe 6 men in the room. And I think about it now and I wish I had have asked for a nurse to be there. But you just go along with what they say. You just trust what they do. Anyway, so I had about 6 of these students and doctors in the room, all men, and they needed to see if I was not lying about how numb my bumhole was. How do you test that? You stick your finger up. It was so embarrassing. I had to take my clothes off. I had a robe on, but he opened up the bottom pretty much, and he did 2 fingers right up and pressing around, and my dignity, my pride was hurt. I had a doctor in front of me, kneeling down to my level, who was amazing, and I left him a beautiful letter afterwards saying thank you so much. He could understand how horrible it was for me. Then they get a pin and they prick just around to see where your sensitivity is and where it isn't. It was just horrible. I just feel I really wish that I'd had a nurse. What did I do then? I stayed in hospital for a good week, but it was almost a blessing in disguise because I needed that time for me, for my depression. I needed to get out of the house. I needed someone to cook me dinner, look after me, and all I did was sleep. All I did was sleep. I was lucky to get my own room at the hospital. I just slept all day. Someone brought me food and cups of tea all day long, and that's all I did. I was there for a week, and then I went home. Oh, I had no TV. I don't even know if I read books. I literally just slept the whole time, and it was good for my depression. It really was. I think I needed that. I was so low at that point. I really was. So I went home, and the doctors had said, we can't do anything unless the feeling to your bladder, like doing a wee, you can't feel that anymore. That's when pretty much your spinal cord is getting severed. So we can't actually do anything or do any surgery for free until that happens. So it was Easter Saturday, and I said to Daniel, something's not right. I said, I think it's starting to affect my bladder because I don't feel like I need to do a wee. Then all of a sudden, I have this horrible, painful urge that I have to do wee right now or my bladder will explode. And that was happening in the last 24 hours. And I said, it just doesn't feel right. So we decided to go into the city, to the hospital where they have neurosurgeons. Not my local hospital that I just spent a week at. We decided to actually go into emergency, St. Vincent's, I think. I can't even remember. We went in, again, prod and poke and all that kind of stuff by doctors. They had left the room and they came back a little while later saying, all right, we've scheduled your surgery, go in now and get prepped and all this kind of stuff. And he left, and I was hysterical. I was crying like a baby. I was just hysterically crying. And the doctor came back in and he was like, what's going on? What's wrong with you? And I said, I'm so happy. I said, you can just click your fingers and just give me the surgery that I've wanted for I think it wasn't almost a year, but it felt like that. And he can just click his fingers and be like, yeah, sure, let's just do the surgery. It was scary. Daniel and I said our goodbye. What do? You're about to go on for major surgery in your spine. It's seriously scary. So they went in and surgery was successful. They took out a 3-centimeter chunk of the tissue. I'll put a picture up as well. And he said it was bigger than they thought. And instead of doing a microdiscectomy, which they just put small holes in, and then they, take it out. They had to cut open my back and then like drill through the bone and actually get access to my spinal cord and take out the calcified tissue. Sewed me all back, all done. I think my scar was about this long in the end. I'll post a picture. And because I'd been on so much medication, they drowned me in medication. I remember I felt like, I woke up and I felt like I couldn't even, all I could do was think. I had no control over my body. I remember the breathing tube I just hated the feeling. I felt like I was drowning all the time. And all I could do was this. I just remember doing this because I was trying to get it off. And I was on so much medication, and I think I was only in for about 3 days. They reduced my medication after half a day because I couldn't speak. I couldn't get the words out. Long story short, I got out. I had no pain. Nothing. My leg, I had all the feeling again. No pain whatsoever. Apart from, just my healing of the scar. I was so happy. I was so happy. I would never wish that type of pain on my worst enemy. Never. And then I got addicted to pain medication again, but it wasn't as bad as the first time. And we slowly, were able to wean me off the medication, and that was fine. And it was great. And 8 weeks later, I relapsed. Happened all over again. I just cried, and I just cried, and I cried. And I was just over it. I started feeling depressed again, and, just continuous MRI scans and seeing the neurosurgeon in the city, and it was a pain. Anyway, what I realized was I need to walk. Strengthening my core is what they recommend, but it always gave me more pain. So I didn't like doing it, but I discovered that if I walked every day, it could be 10 minutes, it could be 40 minutes. My back is fine. I can't lay on my back. I have some mornings that if I haven't walked in the last couple of days, I almost can't get out of bed. So I still suffer with this. I don't have chronic pain anymore, but my back seizes up all the time, especially in the morning. I can't sleep properly at night. I have to lay on my side. I'm constantly moving from side to side because my back gets sore every night, so I don't get full proper sleep. But then I got pregnant with Max, and the relaxin came back in, and I was sweet. I was really good. It wasn't as painful. But no, I still suffer. I still can't lay my back and all of those things I said before. Yoga helps. I'm still breastfeeding Max, so I still have that hormone going through my body. And I'm scared to stop feeding him and to wean him because I'm just scared that my back will get bad. I've got health insurance now, so if I wanted to, I could go get the surgery done again. But it's not as bad this time round. I don't have numbness. The bulge isn't as big as before. All I can do is try to be positive in my life and exercise, be active, be the best person I can be. And I will continue to live with it forever and ever. So this is my story. It's what has made me who I am today. I wouldn't change it because I wouldn't be the person I am if I didn't experience these things. There is so many things I wouldn't know if I hadn't gone through all these experiences. So I hope people understand depression and chronic pain with anyone that's around them or loved ones. And, people need help, and you need to understand that you need to ask for help if it's happening to you. There's nothing wrong with it. I've had to ask so many people to help me. I'm just thinking of one time. Daniel's mum was sleeping over because Daniel had to go for work overnight. And she was sleeping over in the middle of the night. I woke up crying because I needed to do a wee, but I could barely walk. And I got halfway to the toilet and I was just crying because I was in so much pain. I was just crying, and I told her to turn around. I said, get me a bucket, just get me a bucket, anything. I was just crying. So she brought back an old formula container because Maya was having formula as well. And she helped me take my pants down, and I stood in my bedroom while she helped me wee in the middle of the night, wee into an old formula can. Now that's degrading. Could you imagine doing that? I did it. What do? That's just one thing. So, you look at someone, don't judge them. I've learned not to judge anyone because you don't know what they've been through. I might look perfectly fine now. 2 years ago, completely different story. So be compassionate and understanding and lend a hand. It's just helping each other out is what we need to do. And understanding. If someone is depressed or has chronic pain, don't just say, oh, you'll be fine. Just be more positive. It's not going to help. So I hope this video helped some people understand me and who Mama Bear is, because it's what I am. These experiences have shaped me into who I am. Thanks for watching, and my next video will be coming up shortly, I promise. Okay, bye.